If the bone is enough for us, we can do the extraction, putting implant, and also put a temporary teeth in one session. In case of one implant, if it is in the anterior part, in the aesthetic part, if the bone is good, if the bone is enough for us, we can do the extraction, putting implant, and also put a temporary teeth in one session. In the posterior part, the parts that not in the aesthetic zone, in case of one implant, we don't prefer to make a temporary teeth. Extract, put the implant, then the patient goes for the second trip, we put the teeth in that part. If, for example, the patient doesn't have any teeth, we can do in the same trip. For example, because there is no any tooth extraction, it is not very hard to the patients. Just one day we do the lower jaw, the other day the upper jaw. And in the 3 days, the temporary teeth finish, so in the 3 days it finished. But sometimes the patient has lots of teeth that they have to be extract. Then we don't prefer to do it just in one trip because it will be very exhausting for the patients to extract the teeth and doing the implants. That's why we prefer them to stay more than 3 days, for example, for 1 week, or do it in 2 trips. After the healing period finishes, they come and we make the main teeth, the zirconium teeth. There is an implant brand that the healing period is just 1 month. After 1 month, it integrates to the bone. The other brands, mostly the other brands, the healing time is 3 months. But of course, it depends to the patients. For example, sometimes patients come to us, for example, choose the one that heals in 1 month, but during surgery we see that the bone is very soft. Then we tell the patient that we have to wait a little bit more, not just after 1 month to open the implants.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.